Comprehensive report on the Laken Riley Act, immigration, labor, and the progressive left's betrayal of the working class, exposing how Medicare for all and whole Washington distract from urgent worker and immigrant reform's introduction. A deafening silence from the so-called left for 8 years. Injured workers, immigrants, and their families have called on Democrats, unions, and progressive leaders for help. Instead, many of these supposed allies, from Senator Bernie Sanders and Representative Alexandria Ocasio-Cortez to Dr. Jill Stein, Kshama Sawant, and Jason Call, have redirected attention to initiatives like Medicare for all and whole Washington state single-payer, leaving urgent labor and immigration issues to languish. This strategic silence, and at times outright dismissal, has handed a win to elites who continue to profit from detention centers, exploit injured workers, and undermine immigrant families. Meanwhile, Senator Katie Boyd-Britt has championed the Laken Riley Act, a punitive and costly approach to immigration that enriches private prisons and tears families apart. A humane alternative, the American Families United Act, sits untouched, even though it would benefit U.S. citizens as much as undocumented family members. The negligence of the progressive left to champion this cause underscores their complicity in the ongoing betrayal of the working class. This report names names, examines systemic failures, compares modern abuses to historical injustices, and calls for immediate, comprehensive reform. Section 1. The Laken Riley Act, punitive, costly, and counterproductive key provisions mandatory detention. Undocumented individuals charged with theft must be detained, violating core due process principles. State power to sue allows states to challenge federal immigration authority, undermining cohesive national policy. Visa restrictions empower states to block visas, risking diplomatic and economic fallout. Systemic harms constitutional violations, weakens the Fifth Amendment's due process protections. Ballooning costs could reach $83 billion in just 3 years, funneling taxpayer dollars into private detention centers. Collective punishment treats entire communities as guilty by association, reminiscent of historical chain gang practices. Absurdity of blanket guilt if we don't collectively punish every soldier at a base because of one individual's crime, or demonize all Italians for a single suspect with an Italian surname. Why do so with immigrants? The Laken Riley Act contradicts the very notion of individual justice. Section 2. The American Families United Act, a real solution ignored for U.S. citizens and their immigrant relatives, restores judicial discretion, ends automatic reentry bars, allowing judges to consider family ties and individual circumstances. Addresses family separation, protects Americans from losing spouses or children to deportation, stabilizing communities. Economic and social benefit strengthens the workforce. Undocumented individuals gain legal pathways, boosting tax revenues and consumer spending. Counters xenophobic rhetoric, emphasizes that this act primarily secures U.S. citizens, challenging narratives that paint immigration reform as solely for illegals. Comparing it to Laken Riley cost versus value, mass detention under Laken Riley drains billions, whereas legal integration could add $1.5 trillion to the economy over a decade. Punishment versus family unity. Laken Riley separates families. American Families United Act keeps them together. Section 3. Medicare for all whole Washington, and the grand distraction M4A and state single-payer-worthy causes. Universal health care is vital, but not when it eclipses immediate crises facing injured workers and immigrant families. Tunnel vision problem. Politicians and activists fixate on single-payer systems, sidelining the call for a National Workers' Compensation Commission or the American Families United Act. Jason Call's dismiss a local leader turned gatekeeper. When confronted about injured worker issues, Jason Call infamously responded, "Your worker issues can be on our table with M4A and whole Washington," placing urgent labor concerns behind a single-payer agenda. Neglecting the here and now. This approach leaves thousands of workers in limbo, especially undocumented ones facing deportation for on-the-job injuries. Doctors, insurance, and state immunity even if universal health care passes. Malpractice immunity and state laws still let negligent providers and insurers deny or delay care to injured workers, particularly those lacking strong union representation. Section 4. Democrats and progressive leaders. Where's the outrage? Bernie Sanders, sheepdog for unions, publicly criticizes Amazon and corporate abuses, but fails to demand a national workers' comp overhaul or speak out for the American Families United Act. Union silence. Never calls out the Teamsters for using injured workers merely as political talking points. Alexandria Ocasio-Cortez, high profile, low follow-through, grabs headlines, yet there's little action on systemic labor or immigration reforms, particularly family reunification for American citizens. Performative politics. Focus on media-friendly causes over less glamorous but urgent worker protections. Kshama Sawant, Dr. Jill Stein, and the Green Party localism and narrow platforms. Sawant zeroes in on Seattle. Stein on environmental priorities. Neither addresses federal immigration injustice or injured worker exploitation meaningfully. Missed national opportunities. Their influence could have spotlighted the American Families United Act or a Workers' Compensation Commission, but instead defaults to issues that garner simpler messaging. WA state lawmakers. Bob Hasegawa and Marco Leas ignoring medical immunity and workers' rights. Avoid confronting exploitative state laws that let doctors and insurers harm injured workers without fear of real accountability. Teamsters and other unions for advocacy. Publicly rail against employer abuses while failing to champion comprehensive, federally standardized labor protections. Enabling corporate allies. Often mirror the interests of business lobbies like ALEC by not pushing for sweeping reform. Section 5. The Modern Nazi Playbook. Healthcare, labor, and immigration. Nazi Germany's lessons dissolution of unions. The regime replaced free unions with state-controlled labor fronts, crushing worker rights. Weaponized healthcare. Selective care was used to exclude or eliminate marginalized groups. U.S. echoes union decline. With membership at 10-15%, most workers have little collective bargaining power. Privatized detention centers. Profit from forced or coerced labor, echoing historical forced labor practices. Criminalizing homelessness. Ordinances that outlaw sleeping in public push the poor into jails, where they labor at minimal or no pay. Propaganda and scapegoating. Modern elites blame immigrants and the poor for economic or social woes, diverting attention from corporate profiteering and the systematic dismantling of public benefits. Section 6. Economic toll. Hate versus compassion. Cost of mass detention deportation, $850 billion over a decade, wasted on imprisoning people who contribute labor and cultural richness. Family separation undermines community stability and moral values. Benefits of amnesty. $1.5 trillion potential economic boon by legalizing workers who already live here and pay taxes. Strengthen Social Security. Young immigrant workers fill the tax pool as America's population ages. Myth of the American dream. Elites push the narrative of anyone can succeed if they try, obscuring structural barriers like exploitative labor laws, corporate lobbying, and underfunded public services. Section 7. Alabama's complicity, child labor, prison labor, and low workers' comp. Child labor abuses. Documented incidents of undocumented youth forced into hazardous jobs, occasionally resulting in death, paralleling historical chain gangs. Reflects how vulnerable groups are systematically exploited for profit. Prison labor. Inmates in Alabama perform labor at cents on the dollar, serving private interests and the state. Low workers' compensation rates signal a deliberate devaluation of labor. Section 8. The path forward. Real reform, not distractions. Reject the Laken Riley Act and the policy of collective punishment. Cut taxpayer-funded profiteering and uphold constitutional due process. Pass the American Families United Act. Protects U.S. citizens with undocumented loved ones. Boost the economy by formalizing immigrants who are already embedded in American life. Establish a National Workers' Compensation Commission. Standardized protections, especially for injured and undocumented workers, at the mercy of state disparities. Curb the use of medical immunity to deny care and compensation. Demand accountability from the left. Stop prioritizing M4A or whole Washington above all else. Multi-issue advocacy is critical. Call out local leaders like Jason Call who dismiss immediate worker crises in favor of singular healthcare agendas. Insist that national figures champion federal labor and immigration reforms as vigorously as they do single-payer healthcare. End forced labor and criminalization of poverty. Shut down for-profit detention centers. Invest in community-based alternatives. Decriminalize homelessness and shift resources to affordable housing and supportive services. Conclusion: time to hear the working class, not silence them. The Laken Riley Act exemplifies the worst of punitive, xenophobic policy, lavishing billions on detention at the expense of American families, including U.S. citizens. Meanwhile, the American Families United Act sits ignored, despite its potential to unify families and strengthen the economy. Medicare for all and whole Washington remain important healthcare reforms, but have become convenient distractions, allowing progressive leaders to sideline immediate labor and immigration needs. Leaders like Bernie Sanders and AOC have massive followings, yet remain silent on the National Workers' Compensation Commission and the American Families United Act. Kshama Sawant and Dr. Jill Stein focus on narrow platforms, ignoring federal crises. Jason Call's remark about "your worker issues can be on our table after M4A" encapsulates how the progressive left has failed workers by reducing urgent concerns to an afterthought. We must demand better. Call out union hypocrisy and corporate collusion. Expose politicians who champion grandstanding, but deliver no substantive reforms for injured workers or immigrant families. Insist on multi-pronged solutions that tackle healthcare, labor rights, immigration, and corporate power simultaneously. America stands at a crossroads. Continue with authoritarian playbooks, mass detention, forced labor, medical gatekeeping, or choose a path of justice, solidarity, and moral consistency. Breaking the cycle of scapegoating and profiteering starts by listening to and acting on the demands of workers and immigrants who have been dismissed for far too long. The time to fight back, speak out, and legislate real change is now.